Good morning, good afternoon, good evening, and good night, friends and colleagues from across the world. Welcome to today's Podinar session with a special guest, Dr. Armand Gomez, DDS, MD, PhD. Welcome to the show today.
Thank you so much. It's a great honor. And hello from Spain.
Yes, welcome Spain. We love to be able to collaborate with all of our colleagues from across the world. A couple of housekeeping appointments before we get to Dr. Gomez's presentation. It's that time of the year, friends. We are beginning the nomination process for the 2021 World's Top 100 Doctors. These are doctors who enable and empower other doctors in medicine, dentistry, pharmacy, optometry. You're welcome to nominate any of our colleagues. Second, we have recently launched Doctors Comedy show. We invite you guys to come and join us so we can share a smile together. You can find us on Facebook, LinkedIn, Instagram at Doctors Comedy. And another good news is the second book now is in the works after The Power of DR was just recently published, which talks about doctor-to-doctor systems. Well, with that said, I would like to introduce our wonderful speaker of the day. We are really thankful for him coming on and bringing some of his wisdom of many, many years of education, training, aesthetics, practice management, and more. Dr. Gomez is Spaniard and graduated from University of Tübingen, Germany, in both dentistry and 4 years later in medicine, where he obtained his MD. He has received 3 national awards and contests Young Scientist in Germany. So he studied in Germany and returned back to Spain. He has received, completed also a PhD in implantology at the same university. For the past 25 years, Dr. Gomez has been in tight contact with the dental industry, such as Sirona, Espit, Discus Dental, Philips, White Smile, Cable Kerr, and other companies. He worked in the headquarters of Ivoclar Vivadent in Liechtenstein for 3 years, being responsible for scientific communication in Latin America. In the last 20 years, Dr. Gomez has held over 400 lectures, seminars, and hands-on workshops in 42 different countries all over the world. In addition, he's also the author of several publications in different languages. He's also multilingual. He received his training in aesthetic dentistry in Los Angeles and San Francisco. After some years in the most prestigious dental offices of Germany, Dr. Gomez finally moved to Spain in 2004, where he runs his dental office in Valencia, focusing on aesthetic and implant dentistry. He's the former General Secretary of the European Society of Aesthetic Dentistry, which is now called the European Society of Cosmetic Dentistry. Since 2013, he's the Director of Continuing Education Program Specialist in Aesthetic Dentistry of European Institute of Dental Education, EIDE, which is by now held in Saudi Arabia, Bahrain, and Dubai. Wow, what a career you've had, Doctor.
Thank you so much.
We're highly honored to have you. You're going to be talking about more efficient practice management. Please tell us how it started for you. How did you get interested in medicine and healthcare and dentistry? And how did you end up pursuing that route?
Yeah, well, my basic interest was to be a dentist. Once I studied dentistry at the University of Tübingen, I saw that maybe surgery would be a good option for me. And in order to become a maxillofacial surgeon in Germany, you have to have both studies, DDS and the MD. So after DDS, I studied medicine also in the same university, and I finished it. But in my final year, I found out I don't want to be working in a hospital for 5 more or 6 more years before I can settle down. So I decided to leave medicine apart and concentrate in dentistry. So that's why, and aesthetic dentistry, because Ivoclar Vivadent, where I worked for 3 years after I finished all my studies, empowered me to go to dental materials and how to use them. And later, I went to United States. I worked closely with Dr. Bill Dorfman in Los Angeles, and he empowered me and helped me to make some postgrad studies at the University of San Francisco, where he also studied.
Wow. Dr. Bill Dorfman is very well known amongst our colleagues for aesthetic work. Wow. Did you do anything with the aesthetic societies in the U.S., the the American Academy of Cosmetic.
I've been a member at the AACD, but I find it very difficult to travel every year to United States. So I stay in the European part. As you know, we managed to do something very similar to the AACD, but in Europe, and I was a big part of it at the beginning.
Herman, also spelled German. I find it to be a cool coincidence that you studied in Germany and you carry a name that's in a similar pronunciation. I understand you have a long family of dentists and people with the same name.
Yeah, my father is also dentist, and he has been a professor at the University of Tübingen in the field of implantology. And I see there are some people that they also have been at the University of Tübingen. Hello to all of you, and I'm very happy that you follow this Podina.
Lovely. So, Doc, another passion of yours is empowering doctors to do better against businesses who don't have any fraternity to medicine or healthcare, be it people that just open up dental practices for the profit, or I understand the laws are different from every territory. In the United States, you have to be a dentist and own the practice and operate it. I understand in Spain, anyone can own a practice, which is very unfortunate for the medical industry. How do you mitigate that? What are your teachings?
Well, here is the thing. When I opened my dental office in 2004 in Spain, okay, yeah, with Professor Weber, okay, in 2004, I was aware all of a sudden that in Spain, every taxi driver can make a dental office. They just have to hire a dentist. In that moment, dentistry becomes pure business, nothing else. So no hypocrite versus no ethics in dentistry, not looking what is best for the patient, only looking what is best for your pocket. And now, as a dentist, if you open your dental office freshly in Spain, you compete against these people. And these people are pure businessmen. And as a dentist, to compete against professional businessmen is something different than for a dentist to compete against other dentists, who all are amateurs in business. Okay? So for me, it was like learning it the hard way. And I want to share my experience in these last 16 years now in the field in Spain with my colleagues, with my peer colleagues, the real dentists and hygienists, okay, that really look after the necessities and what's best for the patient, so that they survive. They can compete really against these big corporations, these big things that are opening up with a lot of money, with a lot of marketing budget, and we are small against them. So what is our weapon against these things? Our communication, our honesty, and that's what I'm talking about today. I want to talk about the communication, and inside of the communication, a very small thing, the psychology.
That's wonderful. You know, it's quite shameful as to what these corporations have done in medicine and healthcare. You'll fit in right here because our concept is doctor to doctor. We believe that doctors are the most powerful entity on the planet. You know, we have the intellect, we have the intelligence, we have the work ethic, we have the goodwill, we have the reputation. Frankly, the public respects us. We have the healing hand, and we have a lot of talents. If a fraction of doctors gather up and maximize cooperation with one another, I think they would be the ones in trouble, not us. But you hit it right on the nail. We are amateurs in business because we don't learn much in business from school. And we come out and we get the treatment from the corporations, the full treatment. So it's very honorable what you're doing. I respect what, for example, Dr. Stanley is doing with the slow dentistry movement. And empowering other doctors is our mission. So we are very interested to hear what you have to say. So What do you think the first step should be for dentists to up their acumen in business and speaking skills and communications?
Well, first of all, they should go and get some continuing education. But the first step is they should be really proficient and really knowledgeable in dentistry itself. You cannot sell yourself if you're not confident in what you do, not confident in your techniques, not confident in the way you treat the patients. So first of all, and this is the basis of every success, is that you're really good in your clinical skills. Once you are, that does not mean that you will have success. Success is led by other factors, but the basis would be get your continuing education in aesthetic dentistry, in endodontics, in surgery, in implantology, in whatever you think is good for you and makes your life enjoyable, okay, your professional life. And once you are really proficient in that area, then get some continuing education in what is communication skills, sales skills, and all these things.
What is your opinion of signing up for master groups where you gather up with 15, 20 doctors and you exchange information and resources and ideas and things of that sort?
Well, I've seen Bill Dorfman is part of a master group. It's called Maxter Group because they are maximum masters, something like that, okay? So I've seen that for the last 20 years, and it's a very good idea, especially that you can learn out of the experiences and knowledge of your peer colleagues.
Wow. Yes, I think there's more and more of these coming up and popping up. So you're going to be talking about how we can outcompete the corporations. In my opinion, my humble opinion, corporations are big structures that need a lot of ladders to climb before a decision can be made. But we have maneuverability. We can quickly do things in the community. We can quickly change our programs. We have that over them where we can get involved, and they can't that readily. What are some of the other recommendations you may have where we can quickly outcompete these essentially they're parasites in our communities?
Well, so social media is a number one thing that you can do with low cost, okay, but big impact. So you can show people that you care by doing small videos about all the things that you do and how you explain things to your normal patient. This is how you explain it to the camera, and then you put it online. You put it online in all your channels, Facebook, Instagram, Twitter, wherever you can, also YouTube channel. And then once it is online, you repeat that over and over again. You just make a lot of very small videos and put them online, and they talk for you and they talk about you at the end.
That's a great idea. In fact, I have personally, and our dream team members have seen tremendous success utilizing and leveraging social media and our peers. It's a great idea.
Yeah.
But it takes time. You have to be persistent. You have to keep doing it.
Yes, for sure. So it doesn't come from now in 2 days. It's a very slow thing, but consistency is very important. And don't break down if nobody sees your videos. That happens at the beginning. Nobody sees your videos, and then later, more and more people just get access to it. You spread it more and more. It's shared more and more, and then all of a sudden you have some community seeing your videos and sharing your videos.
That's right. And then it takes off from there. It took several years for me to actually gain some traction. So it's all about persistence, just like anything else in life, you know.
Yeah.
So Doc, tell us a little bit about your presentation. What can we expect in the next 45, 30 minutes?
Well, you can expect to get to know the principles of Professor Cialdini. He's a psychologist, okay, and he has written 2 books. And I will just resume these 2 books for you and give you some examples in dentistry. One of these books, it talks about persuasion, not persuasion, persuasion. That means everything you have to do before you really want to persuade somebody, okay? So in the setting up of everything, okay, in the way of psychology, of course. And then I talk about the persuasion principles, how you can influence in the people's mind when you talk about treatment options and you want them to choose one specific option, although you give them several options.
Excellent. You mentioned something in your documents that I read about communications inside the office. Are you talking about systems of communicating between the front and the back? Are you talking about communications with the patient? What are we addressing here?
Today, we are addressing the communication between the dentist and the patient. That means the presentation process of your proposal, okay? You propose to make, I don't know, 3 implants and 20 veneers, something like that, okay? And you want the patient to accept that and not to go to another dentist and for, you know, price fishing or something like that, shopping. But you want him to make a commitment right now to make the treatment with you and not with a big corporation that, of course, is cheaper than you, okay? You cannot compete in price, okay? So what you have to do so that, or what you can use as a psychological background to achieve that goal. It's only a small fraction of what is the communication process, okay? I've written a whole book about the communication process between the patient and the dentist, okay?
Where can this book be found?
Well, on Amazon.
It's called?
Communication Skills Training for dentists.
Skills Training for dentists?
Yeah.
Wonderful. I'm going to put that to the side. If anyone wants to get on Amazon and get a little bit more intimate with Dr. Gomez in terms of his thought process and his ideas for our industry. I really appreciate your presence today, Doc. We want to get to the crux of the matter. So with that said, I'm going to go ahead and disappear, and the floor is yours for your presentation.
Thank you. So I will go and pop up the presentation.
Please.
Okay.
It's all yours. Thank you.
Thank you. Well, you can find also the books in www.dentalbusinessbooks.com. Today, I want to talk about the psychology of saying yes, so that the patient says yes to your treatment options, okay? We will talk about what is persuasion, the different situations of persuasion, the difference between persuasion and manipulation, and the Cialdini's 6 principles of persuasion and how to apply them to dentistry, okay? So here are the books, the 3 books, Sales Skills Training, Dental Patient Communication. They are found in dentalbusinessbooks.com. And you can buy the books in Amazon.com, or if your Amazon is for example, Germany, then Amazon.de. You go into other Amazon stores, and then you find the different. Let's say you are in India. Well, you go to India, and then you click on the link. Okay, good. Who is Professor Cialdini? Professor Cialdini is a Canadian psychologist, and he wrote 2 books. One book that was written in the 80s, it's called Influence, and the other book that is recently presented, it's called Persuasion, okay? So I will talk first about the persuasion principles, because they are really, really interesting for us as dentists when we want the patient to accept our treatment options. Persuasion is the process of arranging for a patient to agree to your offer before he encounters it. What does that mean? So before you even give him your treatment options, you present your treatment options. Before you do that, he already has accepted one of them. That's not magic, that's established science in psychology, okay? So it is about what you say and do immediately before you deliver your message. Your message would be, for example, the presentation of the treatment, your treatment plan presentation, okay? So you prepare the ground first. This is all about the persuasion. You prepare the ground first. This is unperceived by the patient in 100% of the cases. It flies under the radar. So he is not even aware that you're already preparing the ground for him to say yes to one of your treatment options, okay? Of course, the option that you want him to say yes to. So the choices that we make as a patient or as a person, the choices that we make are more related to what is in top of our mind in that moment when we do the choice. You do something that causes the patient to have a positive state of mind towards the idea or the concept of your message. Let me give you some examples before you deliver your message. So if a communicator can put us in mind of a particular concept, for example, fixed. For example, if I want to sell implants to a patient, I want him to think about fixed solutions. If I do a persuasion before I present an implant treatment plan, and this persuasion is going towards the concept of fixed solutions, he is already pre-sold on implants before he even notices it. Also, if you put into the mind of the patient like factors like metal-free or white, okay, you for sure will have to, if you present crowns, metal ceramic crowns or zirconium ceramic crowns or full ceramic crowns, you guide the thoughts of the patients towards metal-free before you present the options, okay? And then he will very likely choose your metal-free option, okay? Or strength, high quality or something like that. If you guide the mind of the patient into a situation or into an area of high quality, he definitely will choose later the more high quality solution, okay, of a treatment. Then we would be channeled to thinking about that as a more important factor in our choice. So if you put in the mind of the patient, on top of the mind, a certain concept, later he will think about that first. That's all about the persuasion, okay? Example, a background picture influences the decisions. Let me explain to you. Robert Cialdini gives an example of a company, a factory that makes furniture. And this furniture is a widespread, like IKEA, but it's not IKEA, okay? It's another furniture company. And this furniture company made an experiment with their clients. As soon as a client got to their homepage, 50% of these clients were directed to the homepage A and 50% to homepage B. A and B were the same homepage. The only difference was the background picture. In one of them, there were clouds, you know, getting the information or passing the information to you of wellness, of comfort, of being relaxed, okay? And the other 50% were directed towards the same homepage, but with a background of coins, money, change, something like that, okay? Now, the ones that were directed to the clouds as a background picture, they chose to look much more the options of very comfortable furniture, sofas, very comfortable ones, okay? The price was not important. The comfort was important. And the ones that had coins or change or money as a background were all of a sudden very price-oriented, okay? So you need to recognize what is the central element of your message. So, for example, white aesthetics or fixed restorations, okay? And so what is the benefit of your treatment that would make it wise for the patients to accept the offer? And you have to, before you make the offer, make the present the treatment plan or different treatment options, you have to put his mind in exactly that benefit. For example, fixed. Then go to the moment before you deliver the message and draw the patient's attention to this idea. Good. By shifting a patient's attention towards a particular concept or idea, we not only shift their attention, we shift who they are in the moment. If I shift your attention towards romance, I can make you a romantic in that moment. If I shift your attention towards price, I can make you a cost-oriented buyer. If I shift your attention to quality, I can make you a quality-focused purchaser. How we do that, I will explain in a second. Okay? How? With our environment. Environment is one of the options we have to focus the attention of the patient. If the environment looks expensive, high-quality environment, it is much easier for us to sell a very broad and very big smile makeover compared to if we do that in a very poor environment, okay? It channels the mind to take more expensive and high-quality choices. The environment is important, okay? Doubling the possibility. It's not, I don't say that, it's science who says that, okay? So if you think you can improve your environment, do it. Your dental clinic should really look the way that you want patient to make choices. Pictures, posters, pictures on screens, okay? Veneers, implants, smile design, all these things can be spread around your office, and this is the environment the patient is in, and he sees all these things. He shouldn't see different posters of different countries, like if you were a vacation company, you know, you're a dentist, okay? You should offer veneers, implants, smile design, and patients love smiles and beautiful things, okay? In your appointment cards, you should show also smiles, okay? Then, what is focal is causal phenomenon. This is a psychological phenomenon that we can take advantage of before we make the offer. Okay, what does it say? It says, what we are paying attention to, normally in our environment, we perceive as the cause of what is going on. Let me explain to you, okay? The Professor Cialdini explains it in a way that in an American football game, okay? Some of the players had ornaments that were very, very, you know, attention drawing, okay? So very neon or something like that, or the helmets were had a different color or something like that. So all the referees were always focusing more on them. And then if a bad situation happened, the referees thought they were the cause of that bad situation because they were always focusing on them, okay? So draw the attention to a feature. For example, in a nice picture, the veneer or the implant of the patient, okay? And the patient will perceive that as the cause of the beauty. of the beauty of this patient, okay, or at the happiness of the patient, okay, happiness or beauty. Now, paint a picture in the mind, already owning a certain treatment, okay? They should pre-own it. A lot of car companies do that. You go to a BMW car sales facility, okay, and the salesman paints a picture in your mind about you owning already that car and driving Napa Valley and this beautiful landscape, and you are thinking, oh, wow, that's really nice. And all of a sudden he has pre-sold you on that BMW, okay? You will, as a patient, prioritize this one above an alternative all of a sudden. For example, patient sits down and it can be true or it cannot be true, okay? You just say, before you even talk about his problems or what else, okay, you might already be pre-informed of what he's looking for, okay, by your hygienist or by your dental assistant. So you know this patient is interested in smile makeovers or something like that, okay? So he comes in and says, hi, how are you? Well, I am really happy. A patient just walked out with her beautiful new smile with veneers, stunning. She was so thankful and happy. So first, we mentioned happiness, we mentioned beauty, we mentioned veneers, okay, beautiful new smile, okay, thankful, and the patient is already pre-sold on veneers without even knowing it, okay? Now, there is also another psychological need in a patient or in a person itself. It's the need to closure. What is that? Well, we need to close a mystery. If there is a mystery, we need to resolve it. There is inattention in everybody to resolve the mystery. So the attention raises and he wants to resolve the mystery. Now, how is that good for us as a dentist? Well, imagine you want to tell the patient that you are very good in implantology, okay? Instead of telling him, well, we are really good in implantology because of our experience, because of we have made already 3,000 cases, whatever. Instead of telling that to the patient, you should make a question first as a mystery. That means, why are we, as an office, for example, perceived as the top office for dental implants in town? Well, all of a sudden, the patient starts to pay attention to what you will say next, because it's a mystery for him all of a sudden. If you would have said that, what you would say next, just like that, it would come in here and out there. But now it gets registered because you made a mystery out of it, okay? That's a psychological trick. That's persuasion. With this sentence, you have persuaded the patient to pay attention to what you will say, okay? And to register it, okay? Now the attention is drawn to your next message. As people want the question to be solved. It's psychology. Good. Or pre-questions, okay? One question at the beginning focuses a new patient on the positive aspects. For example, of you in your office, before you even start discussing anything with the patient. So, one pre-question could be, why did you choose us today? Or, even better, what made us interesting for you to choose us? So now the patient starts to think about all the positive, because it has to be positive, otherwise he wouldn't have called you or office, okay? So somebody told him about your office, he saw some videos on YouTube about your office, he followed you on Instagram and found out you have valuable information, whatever, okay? So something positive is there that made him call your office to make an appointment. So now you bring that to the surface, positiveness towards you. So this makes him much more open for your options. Why did you come to us today? But much better is what made us interesting for you to choose us. Now, pre-question for focus. Now, imagine, Professor Cialdini gives this example. Imagine on the street, somebody is making a survey. So you know that on the street, they stop you and say, oh, do you have a minute just to make a survey with me about your consuming activities or something like that. People that want help for a survey usually get a no, as most of the answers are no. No, I don't have time. No, thank you. No, thank you. No, thank you. Okay. Only 29% agreed in that published survey. Okay. About making a survey. All right. Good. 29 agreed. Now, if the people that made the survey made a pre-question, like, do you consider yourself a helpful person? Then people think, yeah, of course I'm helpful. Yes, I'm a helpful person, of course. Okay. So only with this question, they persuaded the person to be a helpful person. And all of a sudden, then they made the second question was, can you help me with the survey that I'm doing right now? Then 77.3% agreed. Okay, how can we use that for our office? Okay, well, this is more than double, much more than double, okay, of the patients. So you raise much more than double the possibility that a patient chooses one specific option of your treatment plan options. Okay, how? Well, you can make a pre-question, like, do you consider yourself a quality-oriented person? Then you shift his mind towards quality. Do you consider yourself a beauty-oriented person? You shift his mind to beautiful things. Do you consider yourself a comfort-oriented person? You shift his mind to comfort. And do you consider yourself a stability-oriented person? You shift his mind to stability, implants. Okay? For example, well, these are the things that you can do. Of course, before you offer your treatment options. Now, once you do the communication of your treatment options, there are also 6 principles of persuasion that Robert Cialdini described in his book, Influence. Okay. Now, what are these 6 principles? Well, first is reciprocity. Second is scarcity. Third is authority. Fourth is consistency, commitment, liking, and consensus, social norms, and social proof is the last one. Let me just go quickly over them. Okay. Persuasion is the ability to move someone in our direction, to make him more likely to see things our way, or the way we want him to see the things, by virtue of how we present our ideas to them. Not what we present, but how. Through communication. Now, do not mix up persuasion with manipulation. Persuasion involves education, information, genuine facts. The intention is to help. Of course, we're dentists. We want to help. We want the best for the patient. Okay? But sometimes these best solutions are very expensive and the patient is not likely to choose them. Manipulation would involve dishonest presentation of ideas that doesn't help the patient. No genuinity is in it. Okay? This is done a lot of times by people who only want business. And you know what I'm talking about right now. Okay? So reciprocity, one of the principles, is an implied obligation. How do you take advantage of that? Well, if somebody does something nice for us, we feel like obliged to do something nice for them. Example, if I open a door for somebody, this person is like has an inner obligation to help me in the elevator or lift, to keep the door open later for me. Okay, I do something for you, you do something for me. That's reciprocity. Okay, it's nearly universal, but it does not work with self-centered people. They just keep getting things, and they don't feel that need to make something good for you. Okay, reciprocity is an exchange of perceived value. You do something nice for a person, but for you, it's not so much work. So the value is not so high. But if for this other person that receives this this action of yours, if for this person it has a high value, he is more likely to make something big for you as a favor back. Okay, patients usually reciprocate with loyalty, positive reviews, and referrals. And believe me, you need all these three things, okay, if you want to be successful in a hostile environment. And you can give them ebooks about their issue. You can give them white papers. You can help them out with special treatment hours or something like that. You do something special for them. And you have to make them see that you do something special for them. If you do it just like that and they don't see it, there will be no reciprocity. You have to make it see. Small gifts, toothpaste, floss, okay? This helps the patient to be happy. Now, second principle is scarcity. If there are only a few available of it, or it is available only for a limited time, people are more likely to want it. Oh, it's only now, or there are only a few, I want one. It's psychology, okay? So how can you make scarcity work for you? Well, the problem is there are two limiting factors. You cannot use it for a long time, otherwise it's not scarcity anymore, and you cannot use it too often, because otherwise it wouldn't be scar anymore. Now, time-limited offers. You can make time-limited offers. You put an added value package together, like exam, X-ray cleaning, and bleaching in one package for a limited time. Okay, that's scarcity. After this time, it will not be offered for that price. That's it. By the way, I'm not a fan of making discounts. I'm a fan of keeping the price, but add some value. Okay, that's why I tell. That's why I say put added value packages together. Package with a special price in a time, and the time is limited. Time-limited offers, for example, offer an enhanced service. Instead of only making an oral exam, you do an exam and oral cancer screening, for example, but only for a limited time. Then people will say, oh, I make the appointment right away. For example, if you want to reactivate overdue hygiene patients, okay, that are 2 years back, they came to the office, but have not scheduled again a hygiene appointment. You say, well, only this month we have a limited time offer. It's the exam and the oral cancer screening on top of it, but for the same price as the exam. Okay, limited time is the key in that moment. Okay, or an exam and a digital smile design. Okay, people will take advantage of that. Scarcity through reputation. If you establish yourself as an expert in your city or in a certain field, sleep dentistry, for example, okay, then, and there are not many of them in your city, then that's scarcity. And there is only one of you in town. That's scarcity automatically, okay? Scarcity through schedule. Produce scarcity in appointment availability. Imagine you have available appointments, but your front desk gets the instructions from you to tell the patient if he wants to schedule oh, it's this week is really full, but let me see if I can squeeze you in. Okay, so here you do two things. You produce scarcity because it's full, okay, and free appointments are scarce. And second, you produce reciprocity because she does something good for the patient. She squeezes him in. But in reality, there is a free space, but she doesn't say that to the patient. Okay, so we produce two psychological things at once in this moment. Scarcity by numbers. Only X patients get that offer or plan. Imagine you say, wow, I would be so happy if this month I could do 20 veneer cases. I would be so happy. Don't do that. Don't look at it this way. Look at it this way and say, this month, veneer cases are done only for 20 patients because the doctor is very busy and there is only space for 20 cases. So get your space now to do your veneer case. And then patients all of a sudden say, wow, only 10, only 20, whatever, okay? And two of them are already gone. So eight patients left. So they will want it because scarcity is a psychological principle of influencing people, okay? Scarcity by day, only until X date, for example, okay? Or a combination of both. Good. Authority. Become a trusted authority in being a dental problem solver, okay? Dentistry is a trust-based business. Now, you not necessarily have to be an authority, you just have to be perceived as one. Claim it. And that's why social media are so important. You spread your word about yourself and you establish yourself because you give tips and tricks about all things like bruxism, like how to clean an implant, how the implant case is performed, all these things, very small videos, 1 minute videos, you explain very small things. Imagine it's a patient sitting there in your chair and it's asking you a question. And you just answer that question. You get a mobile phone and you just record yourself answering that question. And you put it online. All of a sudden, you start to be an authority in your community. And also, you have to be likable, okay? And reliable, trustworthy expert. You have to be perceived as one. Everything around you should communicate you are the trusted expert, okay? In your advertisement, in your social media, whenever a patient talks about you, he should talk about you as an expert, okay? You claim authority and then later you exercise authority, okay? But claim it. You are a professional. Yeah, but every dentist is a professional. Yeah, but you claim it. And they don't. Increases case acceptance and builds patient loyalty. All these things, okay? Or if that is not enough, imagine you are a freshly graduated dentist and you're not so, you don't have 5,000 cases, you don't have that expertise behind you, okay? Then you use third-party authority to make the patient choose what you say is good. Okay, but not in this case, not because you say it as an authority, because others say it too. Like you claim that studies of prestigious universities, prestigious professors, prestigious countries say exactly that, or celebrities or other professionals state that the treatment option that you are offering him is the best choice in their situation. Okay, in this case, the authority is a third party and not you. Okay, now. The next principle is consistency and commitment. Once a public commitment to do something has been made, people tend to act consistently. What does that mean? Okay, instead of in dentistry, and this is proven scientifically in dentistry, if you give a filled out appointment card to the patient, there are no-shows. Well, that's true because things happen. But you can lower these no-shows just by giving a blank appointment card and a pen. In that moment, the patient has to write down the date and the hour. In that moment, he feels like committed to what he wrote down. And in that moment, the no-shows drop 18%. Only by doing that, of course, you will do. You will send them a WhatsApp or something like that, or an SMS reminding them about the date 3 days before, and then 1 day before again. Okay, and this drops the no-shows even more. But only by doing this small trick and nothing else, 18% of the no-shows drop 18%, because they made a public commitment to that date and time by writing it down themselves. They felt like obligated, okay? Instead of being given this appointment to them, they committed, okay? Now, liking is a big factor. We buy from people we like much more often than we buy from people we don't like. Well, we know that, I know. So the problem is, how do you make a patient like you, okay? Well, likability is strongly based on how similar they are to us. Find a commonality with the patient. It can be the cultural level, the hobbies, the interests of the patient, okay? Fans, are you a fan of, I don't know, Real Madrid or Barcelona? Kids, do they have kids in the age of your kids, okay? What high school did they go to? What college did they go to? Okay, all these things, you can find a commonality and then talk about that the whole time. People see you as similar, and once they see you as similar, they start liking you. That's a psychological trick, okay? And bring that to the surface. Positive connection, you can make a positive connection also through genuine compliments, okay? First, commonalities. Second, you compliment the patient, but genuinely, not like a fake thing, okay? It has to be true, and it has to be something that is really worth complimenting. For example, if he really has taking care a good oral health, you say that to the patient. Wow, I'm so happy to see finally a really good mouth, or taking care of mouth, or something like that. Or if he is very well dressed, you compliment that. Everybody likes compliments, everybody. And praises when they deserve it, but only when they deserve it. And then the third thing, how you can make you be likable, is listen to them. You do 20% of the speaking, they do 80% of the speaking. You do 80% of the listening, they do 20% of the listening. That's a golden rule, okay? Listen to your patient. Show honest interest. Likability has nothing to do with the technical aspects of dentistry. You can be a very good technician, a very good implantologist, a very good prosthodontist, a very good orthodontist, a very good endodontist, okay? The canals are perfectly sealed, but if he doesn't like you, he will not buy from you. That's the problem, okay? He will buy from another dentist who is not as good as you are, and he will get a lower quality. So you have to be likable, okay? Then the next is consensus, social norms, and social proof. People want to follow what those around them who are similar to them are already doing. They feel comfortable doing what others also do. How can we use that for dentistry? What helps? Well, reviews, manage them, thank them. If you have online reviews, thank them. Ask for reviews so that a lot of social proof is there, okay? In your social media, request reviews, state, this is our most popular choice. This is the best sentence ever, okay? So if the patient if you say, okay, this gap here in your mouth, we can make a bridge, we can make an implant, or we can make a removable prosthesis. Okay, these three options. Of course, this is a very condensed resume of what of your treatment option plan. But let us think that you just said that. Okay, then you can say, well, the implant, that is our most popular choice among our patients. All of a sudden, the patient feels much better if he takes the same choice as all the others. Or another, so 20%. You get 20% more yes if you say this sentence. Or you can say, this option is increasing in popularity. So they also feel much better if they choose that option. Okay? Also 20% more. Good. Now, if you want to know more about these things, the dental patient communication, it's here in this book, Boosting Treatment Acceptance, or there are other books like the Sales Skills Bootcamp for Dentists. You find all these things on Amazon or dentalbusinessbooks.com. And in Dental Business Books, you go, if you don't purchase directly from Amazon.com, and you have another Amazon, like Amazon.in, India, you can go to other Amazon stores, and then you just choose your country and you may click there. Okay, so thank you so much for your attention, and let's see if there are some questions now.
Wow, doctor, thank you so much for the presentation. I personally have to rewatch this multiple times. It was so much good information for our colleagues.
Thank you.
That was wonderful. So here's a question. How do you think cultural differences impact the recommendations you have made, custom norms and so forth?
Yeah. In what sense do you mean the cultural differences?
For example, if you're trying to make jokes for one culture patient, they might have a different reaction than somebody else. How do you mitigate that?
Yeah, of course. Jokes is a very important thing, and also religion. Don't go into religion. Don't go into politics. Don't go into jokes that are not globally accepted. Okay, it's better to make jokes about yourself. This is always accepted. Okay?
Yes, that's always accepted, right?
But never do jokes about any nationality, because, of course, maybe the patient is related to that nationality. You don't know. You never know. So jokes, politics, and the third thing is religion. You don't talk about that, never in your office.
That's very smart. Politics as well. Because, I always tell my friends that also dentists that go on social media and post on politics, no matter how genuine you are, when you start talking politics, there's another half of people that are not going to like you, right?
Exactly.
There's no way to win. I don't know why they do it. You create enemies, and you create a lot of them. Yeah. And enemies that are actually your colleagues that like you for what you are, for who you are, what you stand for. So I always recommend also to stay away from politics, religion, ethnicity, all of those things that can set somebody off.
Of course.
So Doc, that was I'm just still so much good information in there. Preemptively, we make a lot of those mistakes also chairside. These patients don't care about what kind of manual dexterity they have or what knowledge we have about 6-degree taper. They wanna be treated well. They don't want to get hurt. They want to come into a clean office. They want to be smiled at. They have a whole set of different priorities than us. So this was quite refreshing. Do you do courses, Doc, about this kind of stuff?
Yeah, we have courses, even online courses, but I do that with the Mastery Academy, which is based in Bahrain. So they have online courses about these topics. And we plan to do in Istanbul a master program.
Very smart. We have some colleagues with the Global Summits Institute out of Dubai and the GCCs actually work with some well-known doctors there. This is a very interesting topic. This could help a lot of doctors around the world get better at what they do. And a lot of the things that you talked about apply to just pretty much all dental practices. Creating, exploring a scarcity, making the patient feel as if you are there for them versus you bragging about what you have accomplished. Nobody wants to hear that. Those things go quite a far way. I love the way you framed all of that.
And patients want to be listened at. If a patient has the, that's why you have to do 20% of the talking and 80% of the listening. So if a patient feels that you have listened to him and have captured his problem, okay, then whatever you offer as an option, he feels that this option is the correct one because he feels understood, okay? So how do you do that? There are also psychological tricks of repeating the last sentence they said, for example, okay, or the last words they said, that it keeps them, that is reassurance of that you are listening to them, okay, that you're present. You have to be present. He wants you to be present and to listen to them. So what is important to them? What makes them feel that their smile is not nice? Maybe you have an idea of, oh, he doesn't like his gummy smile, whatever, okay? But it's not that. It's his long canines. How could you know, okay? He has to tell you. So don't pre-assume things. So let him talk, and he will first like you because you let him talk, and you're the first one who really understood him in his heart, you know? And that decides much more about whether or not you are going to make the treatment and not another one than if you have a lot of diplomas there behind you and a lot of courses made. If he doesn't like you, you will not do it.
Wow. So trust is a big factor, right? Ultimately, all of the small talk and all of that leads to trust and a patient rapport that you deploy in your practices. Now, tell me, Doc, 95% of the time this probably works, but what do you do the other 5% of the time when the patient starts talking about unrelated topics and having bitten into a salad or a piece of chicken and broken their teeth and all that? What do you do?
That's good. So I let him talk, and then I say, "Wow, it seems as if you had really a great time with your nephew this weekend. But let me ask you a question." Boom.
Gone, right?
Yeah.
Okay. Because that could go on for a long time, and it can lead to nothing because you're not trying to help them, and they're telling you about something that, well, you know, another patient in the chair is waiting for you to care for them.
Of course. You have to interrupt them, not like immediately, but after a while, and you see the conversation is not going in the direction I want, okay? Then you just be assured that you have heard what he said and you are interested, okay? And by saying, wow, it seems as if, blah, blah, blah. And let me ask you a question. And then you start redirecting the conversation into their mouth, their teeth, what is really important.
Do you ever like put your hand on a patient's shoulder and say, hey, everything is going to be okay? Some people are okay with that. Some people are against that. I don't know.
Yeah, cultural thing, okay? There are some cultural areas where we do not touch the patient, okay? But some patients, if I feel...
I've never had a problem with putting my hand on someone's shoulder and saying, hey, it's going to be okay. You're going to get through this. It's going to be fine. And I see a lot of apprehensive patients, you know, that we also, a lot of them we put asleep, but...
Yeah, in most of the cultural areas, it's okay. But if you put the hand on for example, a married Arabic woman and say, it's going to be okay, this is not going to help, okay?
Yes, problem.
So that would be a problem. And some of our patients, because I do a lot of lecturing in Arab countries, they come from there to our...
Yeah, that's a no-no. I'm talking now American culture, European culture.
I think there's no problem. And you show empathy, which is really, it makes you likable.
Yes, likable, funny. Do you ever take a minute to do something different for them? Maybe get them a pillow, maybe a blanket. I've done those kind of things, and they end up writing reviews about it. This guy just stopped his procedure. He went and got me a blanket and got me water and got me this and got me that.
Immediately, not only you, your whole team should be aware of whether or not the patient is comfortable and whether or not the patient is okay. And for example, if we see a patient has dry lips, he gets Vaseline done or lip balm, and then he gets this lip balm as a present for him to take home. All these things, okay, very small things that make the patient experience different. But that's a whole other chapter.
Yes, I'd love to have you back on the show. In fact, you're going to get an invitation from the Board of Regents as well as the Global Summits Institute organizing members. We're currently writing a book with our second edition book that is titled Doctor to Doctor. Love to have you contribute a chapter if you're willing. And some information will come your way. And we hope to have you back on the show. I was so happy to have you. This was a fresh breath of air of someone that really cares for the profession and enabling and empowering other doctors with little tips and tricks. You know, our lives are very stressful. We have families, we have offices, we have continuing education to worry about, and all of the other things. And at the same time, we're trying to help X amount of patients a day to have a better quality of life. So those that help us, we are grateful, ever grateful for it. And I really thank you for what you do for the profession and all that you have done to contribute today for us. And look forward to having you back on the show. Maybe in 2021 will be a better year for everyone.
For sure. But worse than 2020, I don't think.
Not possible. What are you going for? The Russian vaccine or the US vaccine coming up?
German vaccine. It's done in Tübingen University, in my alma mater.
Is that really? Really?
It's true. Yes.
That is lovely. So they're actually, is it out on the market?
You know, they are now in the first clinical testing phase.
So what are it, 6 months to a year before we see something?
Yeah, beginning of next year.
Beginning of next year. I think once the vaccine comes out, things are going to start heading towards whatever the new normal is, but it'll be better than this.
For sure. Yeah. I hope so.
Thank you so much for your time, Dr. Gomez, and we look forward to having you again.
Thank you. It has been my pleasure and a big honor to share everything with you. And I'm a big fan of you, Dr. Shah, and what you have built, okay? So I'm honored and happy to be part of it. Thanks.
It's our duty to serve the profession. Thank you, Dr. Gomez, and I appreciate it. Have a great day.
Bye-bye.